Hello, dear friends. Good evening. I'm Dr. Ritu Sethi, Senior Consultant, Obstetrician and Gynecologist, Cloud9, Sector 14, Gurgaon. So, dear friends, today I'm back again with another section on Doctor's Diary. Today, the topic is ectopic pregnancy. This is a topic which I've seen, patients are actually what should I say, very scared of this topic. And as soon as the word ectopic comes to their mind, everybody feels that, oh, something, this may pregnancy might not be possible in the future or something like an emergency situation. Very rightly so. Ectopic pregnancy is actually an emergency situation only. But first of all, let me explain to you what exactly is an ectopic pregnancy. Now, the normal location of a pregnancy, as everybody is well aware of, is the uterus. So, in case the pregnancy is implanted outside the uterus, sometimes it can be implanted in the tube, sometimes it can be implanted in the mouth of the uterus, sometimes it can be implanted in the ovary, or might even be implanted in the abdomen. These kind of situations are called ectopic pregnancy. Ectopic meaning something which is out of the ordinary. So, seeing the literal meaning in mind, ectopic pregnancy is a pregnancy which is not present in the normal location and it is present outside the uterus, which is the actual location of a pregnancy. So, what exactly are the doubts which are arising in the minds of the patients and from my clinical practice? I would just like to clear all the doubts and misconceptions. And please, friends, feel free to ask as many questions as you want. You can even come to me, visit me for any kind of queries which you might have and which you might feel are not getting sorted out in this live session. So, first of all, what is the cause of an ectopic pregnancy? Now, I would just like to tell you that the lining of the fallopian tube or the tube in a layperson's language is something where fertilization occurs. That is, the egg and the sperm meet in the tube, and this is a major function of the fallopian tube, that is, fertilization of the egg. After fertilization occurs by certain hair-like growth which is present in the lining of the tube, the fertilized egg now transports to the uterus and it gets implanted over there. In case the fertilized egg just stops in the tube, then it leads to what is called an ectopic pregnancy. So, friends, first of all, why is this ectopic pregnancy of so much of concern? And the most common, question which patients ask me is that, doctor, can this pregnancy be actually pushed into the normal location, that is the uterus? The answer for this is a big no. The main reason for this is that once pregnancy gets implanted and it starts growing in the tube, there is no mechanism whatsoever which can push this fertilized egg into the normal location, that is the uterus. So, how much time does it actually take for the fertilized egg to travel from the tube and get implanted into the uterus? This takes about 5 to 6 days. Once fertilization occurs, the fertilized egg travels all the way down the tube and gets implanted in the uterus. In case there is some stoppage or there are certain mechanisms by which the lining of the tube is getting destroyed, because of which this transport of the fertilized egg cannot occur. The fertilized egg, it gets stopped in the tube itself, and because of this, what happens is that it starts growing in the tube itself. So, can a normal pregnancy happen? So what if it is not growing in the uterus? Can it grow in the tube? The answer again is a big no. The main reason for this is that the diameter of the tube is only 1 centimeter. So imagine, in a 1 centimeter diameter, how can you expect a full grown baby to grow? Not possible. I hope I'm clear about that. So, what happens? Once the pregnancy starts growing in this tube, which is the diameter of which is only 1 centimeter, it sort of kind of distends it. That is, the tube starts distending, and finally, in case the pregnancy grows to a certain extent, the tube might suddenly rupture. And because of this, there might be massive bleeding in the abdomen, which is then an emergency situation. So, what happens in case there is an ectopic pregnancy and if it is not detected in time? It can also become a life threatening emergency. A life threatening emergency meaning in the case in which the tube just ruptures, there is massive hemorrhage inside, there is massive bleeding inside the stomach, inside the abdomen, and the patient comes with an acute abdomen to the emergency. Once we do a pregnancy test, we find out that it is positive, but because there is so much of blood, the first suspicion will be that of an ectopic pregnancy, which turns out to be true in most cases. So, can't we what is the reason for this pregnancy not getting implanted in the normal location? And what is the reason behind this phenomena of an ectopic pregnancy, rather this condition of an ectopic pregnancy? Now, dear friends, the main cause of this is loss of the lining of the tube. The lining of the tube can be lost in case one is taking certain drugs which retards the beating of the hair-like projections which are present in the tube, or certain factors like smoking, which might just destroy the lining of the tube, or in case any patient has had any kind of infection. Now, any kind of infection in the pelvis leads to destruction of the lining of the tube. Because of this destruction of the lining of the tube, the patient becomes susceptible to what is called an ectopic pregnancy. So, what can we actually do to avoid an ectopic pregnancy? See, first of all, in case you feel that you are having recurrent infections, mind you, it is very, very important for any lady to visit her gynecologist at the first instant in case she is having recurrent infections of the pelvis, in case she is having recurrent discharge PV, which is foul smelling, in case she is having a lot of pain abdomen. Why? Because all these conditions predispose to destruction of the lining of the tube, which predisposes to an ectopic pregnancy. So, do watch out for this kind of a silent problem, which might not be silent in case you end up with an ectopic pregnancy. So, what else can you do to prevent this condition? In case you feel that you are at a high risk of having this problem, in case you feel that you are having, one has had recurrent infections and she is more susceptible to this problem, please do go and visit your doctor at the first instant. Go and visit your doctor the day the urine pregnancy turns out to be positive, which is 2 days after the missed period. Mind you, in this kind of a situation, that is in an ectopic pregnancy, the urine pregnancy test might not again be so visible on the urine on the kit which you might be doing as a home pregnancy kit. So important is to again go and get a blood test done. The blood test titers will be much lower than they are for a normal pregnancy, and your doctor might even order you to get your serial blood test done for the hormone of pregnancy, which is called a beta HCG, in case she feels that the serial titers of the beta HCG which you are doing is not increasing to a satisfactory level, then she might get an ultrasound done for you, an internal ultrasound, and this ultrasound will more or less diagnose your problem. In case you have started bleeding or spotting before that, then again, please do visit your doctor because bleeding anytime during pregnancy is not normal. Again, an internal ultrasound will be done for you, and this problem will be might be picked up on an internal ultrasound. Also, in case you feel that you are having acute pain abdomen, something which is not bearable for you, that is another reason why you should visit your gynecologist, who would be ordering an internal ultrasound for you, in which this ectopic pregnancy will be picked up. So, friends, is an ectopic pregnancy only, is it a life-threatening emergency? In case it is picked up at an early stage, when the blood levels are less than 3000, then the ectopic pregnancy usually does not rupture. What is the treatment for this ectopic pregnancy? Now, ectopic pregnancy can be managed in two ways. One is a medical management of an ectopic pregnancy, and one is a surgical management of an ectopic pregnancy. Medical management is something which I am doing routinely, and it is done for those patients who come to me once a pregnancy test comes out positive. But again, the positivity of the test is not as much as we would see on a normal routine pregnancy. So by getting serial beta HCG titers done and ultrasound pelvis done, we pick up this problem, admit the patient, give her an anti-cancer medication, which is called methotrexate, in the hospital, keep her for a day under observation, and the results of this injection are again very good. In 90% cases, the patient just needs to be on follow-up with again the beta HCG titers, and she is cured of her problem within 2 to 3 weeks. In case somebody has taken this anti-cancer medication for dissolving the ectopic pregnancy, the only thing which I tell patients is to avoid the pregnancy for the next 3 months, to use some kind of a suitable contraception, and come back to me after 3 months in case you are very kind of apprehensive and very doubtful about how healthy your tubes are. Only then, after 3 months, we will advise you to plan and go ahead with the next pregnancy. But in case we feel that the pregnancy is growing too much, the heartbeat has come in the tubal pregnancy or the pregnancy which is present in the fallopian tube, then you might even be advised a surgical treatment. Now, surgical treatment again is a matter of choice. Some patients would not like to go for a medical management initially, they would just like to go for a surgical management at the very outset. So, but in case the titers of the beta HCG are very high, then medical management is totally ruled out in the patient's favor, and she is advised to go in for a surgical management. Now, what kind of surgical management is done for an ectopic pregnancy? For an ectopic pregnancy, a routine keyhole surgery is done. This type of surgery I'm doing routinely in Cloud9 Hospital, and it just takes the surgery lasts for around half an hour, in which we remove the affected tube along with the pregnancy. Also, we can simply cut the tube open and remove the pregnancy, which is called a salpingostomy. But in that case, I have seen the results are not that good. In case the tube is damaged, I would prefer to remove the tube, which is called a salpingectomy. If it is a medical emergency, that is, the tube has ruptured and there is too much of bleeding inside the abdomen, then the patient might even have to be taken up for an open surgery. Now, the main concern which patients have after this kind of a problem is, doctor, in case one tube of ours is removed, will I ever be able to get pregnant? See, this is a very relevant question which usually comes to the mind of the patient, and very understandably so. Because the function of the tube, like I told you, is to fertilize. It is a place where fertilization occurs. But mind you, in case you are having one tube intact, then again, chances of pregnancy don't become 50%, they become approximately 75%. And pregnancy, of course, is very much possible. And I have seen patients go on to deliver healthy babies even after having an ectopic pregnancy with removal of the tube on one side, provided the other sided tube is normal. So, friends, I would just like to tell you that please do watch out for these symptoms. In case you are having any such symptoms, or if you feel that you are at a high risk of developing an ectopic pregnancy, then you have to please visit your doctor at the very outset, the day the pregnancy test comes out positive. And yes, these days there is another problem. Because of the rising incidence of cesarean section, I have seen many pregnancies happening in the cut which is given on the uterus or on the cesarean scar. This is called a scar ectopic pregnancy, which again is a problem which can even be life threatening to the patient and has to be managed meticulously. We are managing these kind of problems routinely at Cloud9. So, in case any of you has any doubts or any queries in your mind, please go ahead, visit us, and you can always get all your queries, all your doubts solved. And these surgeries, I'm also doing keyhole surgeries, are something which I'm doing routinely for this problem. And I've seen a very good outcome. After a keyhole surgery, the patient is discharged within 24 hours without much problems happening, and without much pain or any kind of side effects of the surgery. And they come back after a week to get the stitches removed, after which we tell them that they can go ahead and plan their pregnancy maybe after a few months. So, in case any of you have any doubts, you are more than welcome to ask your doubts in the session, or pay me a visit at Cloud9 Sector 14, Gurgaon. I hope you enjoyed today's session, and please, I would be more than welcome to answer any of your queries. Okay, now, yes, Rashmi has asked me a question that she wants me to do a session on after delivery care. Yes, Rashmi, why not? I'm so glad that this question has come up, and I would be more than happy to entertain all your questions. And we will definitely do the next session on delivery care, after delivery care. So, please do share this session of mine, and please do share with your friends, and I would be more than happy to take up this session on after delivery care for the next upcoming session, which is next Thursday on the 18th. Any other doubts, any other questions, please go ahead and ask me. Okay, thank you so much for asking your questions. And I hope you all have gained some kind of information, and there are some relevant take home messages from this session of mine. Please do share my talk on as many platforms as you can, so that the benefit of this can reach as much audience as possible. Thank you so much for joining me. Good day.